Okay, yes, thank you so much for having me. Really excited to talk to you guys today about genetics, cancer genetics, all of the things, and answer any of the questions that you might have. And like Sheila said, my name is Cheyla. I have a background in biology. I have my master's in public health with a concentration in genetics. So very passionate about educating the masses on genetics and genetic services so that everyone has equitable access to these services because they're very important. Historically, I think genetics has been for, people of privilege. And I just want to get it out to the world that everybody could benefit from genetic testing, no matter your background, your race, your ethnicity, all of those things. So very passionate about that. And then I do have my master's in genetic counseling. So currently, I am a cancer genetic counselor. So I see patients at UT Southwestern who have cancer themselves. They've had a cancer diagnosis in the past, or they have a strong family history of cancer. And previously, I was a prenatal genetic counselor. So I saw pregnant women who had high risk pregnancies. So kind of a very specialized training in all of genetics overall, but currently working in the cancer space. So I'm going to share my screen because I have a few slides to go through. If you have any questions, feel free to drop them in the chat and we'll get them answered after the presentation. So, today I'll be presenting about what you need to know about hereditary cancer and genetics. So the number one thing to know about cancer is that cancer is common. Just like Mr. Patterson was saying earlier, as long as we live, as long as we are alive, we all have a chance of developing cancer. It's just a part of being human. It's a process of aging. And as we go through our life, we acquire different environmental things, lifestyle things that attribute to the development of cancer. So, just to review a few population risks for cancer, in general, the average woman has about a 12% chance of developing breast cancer in their lifetime. We all can name at least one person we know that has had breast cancer. When it comes to prostate cancer, every man has about an 11% chance of developing prostate cancer across their lifetime. Colon cancer, also very common, 5.5% lifetime risk of cancer, of colon cancer. And then ovarian cancer, common, but a little bit more rare than these other cancers I just mentioned. Each woman has about a 2% chance of developing ovarian cancer in their lifetime. So this shows just how common these cancers are. And yes, these numbers might seem low and relative, but if you consider the span of a lifetime from 0 to about 80, 85 years old, there's many years that a person has the chance to develop cancer. So when we think about cancer, we kind of put it into these three categories that you see here on this pie chart. So majority of the time when a person develops cancer, it's what we call sporadic or environmental, or just, by random chance. And it's because of these risk factors you see here listed on the left. Age is a major risk factor in the development of cancer because we just know as we get older, we have more chances to develop cancer just because our cells are rapidly dividing over the course of our lifetime and can acquire some mistakes that can cause cancer to develop. Hormone exposure is another big one. Smoking, your diet, weight, alcohol consumption, and family history is also key here. When we think about those risks that I listed earlier, for the average adult, there's those risks, but if you have a family history of breast cancer, your other family members are going to have a higher chance of developing breast cancer. If you have a risk of colon cancer, other families are going to, if you have a history of colon cancer, your other family members are going to have a higher risk of developing colon cancer. And that's where this familial category comes in with cancer. Sometimes we see cancer running in families, so you might hear people say, oh, breast cancer runs in my family, or stomach cancer runs in my family. Prostate cancer is a big one that runs in families. And that's just because we share an environment and also we share our genes with our family. So we already have that tie to them, and we share that environment with them. So sometimes that's why we can see cancer running in families. But then about 5 to 10% of the time, we can find that cancer is what we call hereditary. And when in genetics, when we say something is hereditary, we mean that it is genetic, meaning people are born with a genetic predisposition to develop certain types of cancer. And this is something that no one can control. It's a mutation that's been in the family for generations and generations, and it's being passed down. So that's what we'll focus on here today, is that hereditary category. So just a little genetics 101 for you. We have this fella here, we'll call him Billy. You can see if we take this magnifying glass and we zoom into his body, we see cells. We all have thousands and thousands of cells in our body, and that make up our organs, that make up who we are as a person. Within this cell, we have a nucleus that holds our chromosomes, which is the DNA that we get from both of our parents, both of our mom and dad. And the DNA is where the genes that we'll talk about today are located. So this is a picture of our chromosomes. We have 46 of them. 23 will come from our mom and 23 come from our dad. So we are 50-50 each of our parents. And if we were to zoom in into these chromosomes, we'll reach our genes that are also our DNA. And within those genes are the DNA makeup that create proteins that have different functions in our body. So here in cancer genetics, we will focus on the genes that are within our chromosomes that are designed to protect us from developing cancer. So we have genes in our body that their function is to correct mistakes during DNA or cell replication, because those mistakes can accumulate and turn into tumors, which turn into cancer. So we have specific genes that are just looking to make sure that if there is a mistake, that mistake is created so that everything proceeds as normal. But when a person has a genetic mutation on one of their genes, it causes the protein to be incorrectly created, or causes the protein not to work, and then that protein cannot do its job in protecting against the development of cancer. So in general, for the average person who does not have a genetic mutation that they're born with, in each cell, we have these two copies of the genes that are normal. So the green one, there's no mutations on it. The orange one, there's no mutations on it. But as we're going through life, some cells can acquire mutations. So we see this orange mutation on the orange chromosome, but the green one's working fine. We're going about our life. There's no cancer developing. But then another mutation is acquired on the one working copy left, and this is how a tumor develops. Once the tumor develops, this is how more tumors acquire, and then cancer happens. But in hereditary cancer, one damaged gene is already inherited from the start. So you see in this version, a person is born already with a mutation on their orange copy of the chromosome. So they already are at a disadvantage or at an increased risk to develop cancer. And so as they go through life, maybe at a younger age, they'll acquire another mutation that then causes them to develop a tumor earlier than the person who wasn't born with the genetic mutation. So why is genetics important when we think about cancer? Well, like I said earlier, 5 to 10% of cancer is hereditary. So it's important for us to determine when a person gets cancer, especially if they get it at a younger age, younger meaning below the age of 50. It's really important for us to do genetic testing to determine whether that cancer was caused by a genetic mutation or whether it was one of those sporadic or environmental type of cancers. Finding out whether a cancer was genetic leads to increased screening or risk-reducing surgeries for that individual. So if we know an individual's cancer or the cancer in their family was caused by a genetic mutation, then we can make sure that person has more cancer screening. That might mean having more frequent mammograms and having those mammograms starting at a younger age than normal, or having colonoscopies more frequently or at a younger age, or having surgery such as a mastectomy to remove the breast if the person has a higher risk for breast cancer, or surgery. Some people have high risk for stomach cancers, and they might need to have their stomachs removed at a younger age before stomach cancer develops. There are certain behavior modifications that are recommended for people that have genetic mutations that increase their risk for cancer, certain medications that can be taken to prevent the development of cancer. And then a really important piece of genetic testing is that it can help family members know that they may be at risk. If a person has a strong history of cancer and we find out that cancer was due to a genetic mutation, we can test their family members to see if they also have that increased risk or that genetic mutation, and they can know what they can look out for to completely prevent or catch those cancers before they happen. And that's just because we know if an individual has a genetic mutation for cancer, then their first degree relatives, so their brothers, their sisters, their parents, their children, are at a 50% risk of also having that genetic mutation. So really important for family members, because if they have a family member with cancer, they can help their other family members who have not had cancer yet prevent those cancers. And then in a person who has cancer, it may impact their eligibility for targeted treatment therapies. So with certain types of breast cancer that are due to genetic mutations, there are certain types of chemotherapy that work better on those cancers. Pancreatic cancer is another cancer that, if it is genetic, chemotherapy agents work better on those type of cancers. So really important to see whether genetics is a factor in a person's cancer. So when should we suspect that hereditary cancer is happening? If you have a family history in which 3 or more family members on the same side of the family have the same types of cancer or related cancers, that's a red flag that maybe there's something suspicious going on genetically that we need to be testing for. If an individual has an early age of diagnosis, if we're seeing breast cancer, for example, in a person who's 45 or younger, red flag, definitely needs genetic testing. If they have certain types of hormone markers in their cancer, definitely want to consider hereditary cancer being a factor and get genetic testing done. If we see a family who has multiple generations of cancer, so their grandparents had cancer, their mom, their aunts, their uncles, their dad had cancer, their siblings had cancer, their children's had cancer. If we're not seeing cancer skip a generation, definitely suspicious that there could be something hereditary going on. If a person has multiple primary tumors, meaning they have maybe had breast cancer and then they had ovarian cancer later, or they had colon cancer and then had uterine cancer. If they had breast cancer more than once in separate breasts, definitely want to consider hereditary cancer. Bilateral cancer is another big one. So if a person gets kidney cancer and both cancers at the same time, suspicious that there could be something genetic going on. Again, with breast cancer, if they have cancer in both breasts at the same time, want to definitely get genetic testing. And then there are certain patterns that are specific to cancer syndromes. So if we see a family history in which family members have breast, ovarian, and prostate cancer, that's very suspicious of a syndrome called hereditary breast and ovarian cancer syndrome. Want to get that family tested for genetics. Colon and endometrial cancer is also a specific cancer syndrome pattern that we look out for. So we would definitely offer that family genetic testing in that case. So we have these BRCA1 and 2 genes that were the first hereditary cancer genes to be discovered. And they were first discovered in the Ashkenazi Jewish women population, which is why you might hear people of Ashkenazi Jewish descent pursuing genetic testing. And this is also one big reason why genetic testing has not historically been offered to people who are not Ashkenazi Jewish descent. So definitely want to dispel that myth that only white women need genetic testing. Everybody needs genetic testing, no matter their ancestry. So these 2 genes, you might have heard of them referred to as the BRCA1 and 2 genes or BRCA1 and 2 genes. These, again, were the first genes discovered that increase a person's risk to develop cancer. And the cancers that a person is at risk for if they have genetic mutations in these genes are female breast cancer, male breast cancer, ovarian cancer, prostate cancer, pancreatic cancer, and melanoma. So again, if we saw a family who had a history of multiple of these types of cancer, we would definitely think there was something genetic going on, and it would specifically probably guide us to BRCA1 and 2 genes. So the breast cancer risk with these genes, for the BRCA1 and 2 genes, it's up to about a 65 to 70% risk over a woman's lifetime that she could develop breast cancer if she has a BRCA1 or 2 or BRCA1 mutation. And that's as compared to the 12% lifetime risk in the average adult. With BRCA2, it's about up to a 50% risk, so lower risk with BRCA2, but there is a risk of developing a second breast cancer with these gene mutations, about a 40 to 60% risk that a woman will develop another breast cancer if she has a mutation in this gene. So for people who have high risk for breast cancer, that could be due to their family history alone or due to the fact that they have a genetic mutation. There's different screening recommended. So in the general population, it's recommended that every woman do self-breast exams starting at age 20, and that yearly mammogram start at about age 40. That's if you have average 12% risk for breast cancer. But if you have any family history of breast cancer, your risk is higher, or if you have a genetic mutation for breast cancer, your risk is higher. In that case, still start self-breast exams beginning at age 20, but you also want to start MRI exams of your breast at age 25 and yearly mammograms starting at age 30. And kind of what this looks like screening wise is that every 6 months, you're either having an MRI or you're having a mammogram. So you're getting year-round breast screening. Other options for women who have a higher risk for breast cancer is to have a prophylactic mastectomy. And this is definitely something recommended in women who have genetic mutations that increase their risk for breast cancer, because it's very likely that if you have a genetic mutation, you probably will develop breast cancer. Doesn't mean you're absolutely going to get it, but there's a much higher chance that you'll get it. So for these women, it's recommended to have a mastectomy because it reduces your risk of developing breast cancer by up to 95%. Having a prophylactic oophorectomy, which means having your ovaries removed, can lower your breast cancer risk by 50%. And that's just because as a woman, our ovaries create a lot of hormones. And having them removed decreases that hormones, and it decreases the chances that you'll get hormone-induced breast cancer. It also reduces your risk of ovarian cancer. For women who have these genetic mutations for breast cancer or higher risk for breast cancer, sometimes taking a chemo prevention drug like tamoxifen can reduce the risk for breast cancer if you take it for 5 years. And then improved diet and exercise can always improve our health outcomes. Other cancers that are related to the BRCA1 and 2 genes are male breast cancer, as I stated earlier, up to a 6% risk for males, ovarian cancer, up to a 40% risk for ovarian cancer. Prostate cancer is a pretty high risk for men who have BRCA mutations, up to a 30% risk as compared to that 11% risk we saw earlier. And then pancreatic cancer is also a risk with BRCA mutations, as well as melanoma skin cancer. So before we talk about genetic testing for these hereditary cancer genes, I do want to kind of lay the landscape of genetic testing and how it's changed over the past 20 years or so. So in 1994, the BRCA1 gene was discovered. And then 1995, the BRCA2 gene was discovered. A year later, in 1996, breast cancer test or BRCA testing was available for women who had breast cancer. And at this time, it was really only being offered to women of Ashkenazi Jewish descent. And that is because there were only about 3 mutations identified at that time. And it was mostly identified in the Ashkenazi Jewish population, and these are called the Ashkenazi Jewish founder mutations. Then around the late 1990s, there were a few more mutations discovered, and so genetic testing was expanded for those mutations. And as technology progressed during the early 2000s, we were able to do more than just sequencing. We were able to look at more mutations in the BRCA genes, but still wasn't really widely available to everybody. And it was very, very expensive, like upwards of $2,000 to $5,000 to have this test done. But then, and then you could only test for 1 or 2 genes at a time. It was very expensive. Like I said, not widely offered. But then in 2012, there became multiple more genes discovered for breast cancer and other cancers. And we were able to test for more genes at a time, and genetic testing became more widely available for everybody. So just to show you how much has changed since 2012 until now, before in 2012, only BRCA1 and 2 were tested for breast cancer, as well as a gene called TP53 and PTEN. But now we can test for all of these genes you see here on the right at the same time here in 2022. All of these genes here you see listed are genes that relate to some of the most common cancers like breast, ovarian, colon, stomach, thyroid, cancers like that. And the genes listed in the green are all breast cancer related genes. So you can see we went from only being able to test 4 genes for breast cancer to being able to test over 15 genes related to breast cancer. Then we have more genes that we can use to test for colon cancer here that you see listed in green that are widely available on most genetic testing panels, and many more prostate cancer genes you see here listed in green that we're able to test on the most common cancers panel. So now I know a lot of you had questions about the genetic counseling and the genetic testing process. So what typically happens in a genetic counseling session is we assess a patient's personal and family history. So we start by asking many questions about a person's personal history, their cancer screenings, if they've had a personal history of cancer, what that was like, how old they were when they had that cancer, and what type of treatment they had. And then we'll ask their family history of cancer, what ages everyone had the cancer, and we kind of draw what's called a pedigree that shows each generation of the person in the family and what their cancer was. Because that kind of gives us a good picture of the cancer happening in the family, and we're able to see whether there are any patterns that alert us to the fact that hereditary cancer might be a factor in this family. We then counsel patients about genetics and the implications of an identified mutation. So we kind of talk through how I talked through with you all about how majority of the time cancer is sporadic or happens randomly, but that a small percentage of the time genetics can be hereditary. And we'll talk about inheritance and how the pattern looks in the family. And then we'll talk about what it means if there is an identified mutation in the family. At that point, we discuss the risks and the benefits and the limitations of testing. Benefits of genetic testing is, like I said earlier, we get to know what cancers an individual is at risk for and what their risk looks like over their lifetime and what type of screening can be done. Risks of that can cause increased anxiety about cancer, increased stress on family relationships, because this is a genetic thing, meaning people can pass this down to their children. So there can be some parental guilt. Parents can since parents pass this to their children, there could be fault or blame associated with the genetic mutation. So that's something that we dive into during genetic testing, just to make sure a person is psychologically ready to receive these types of results. And then there are certain limitations when it comes to genetic testing. We don't know everything there is to know about cancer. We don't know everything there is to know about genetics. And so we are limited by the information that we know at the time. So a person can have a very strong history of cancer and their genetic testing can come back negative. And that can be frustrating because it's like, we probably know there's something genetic going on, but we just don't have a test that's good enough at this time to identify the specific mutation. And this is something, especially in populations of non-European descent, just because when it comes to genetics, we have the most information about people who have of European descent. So people of other ancestries or ethnicity, we haven't been doing genetic testing on them for very long, so we don't have a lot of information about those populations. So especially for African Americans or Middle Eastern people, Hispanic people, we don't have as much information in the database. So their genetic testing has a higher chance of coming back with more what's called inconclusive or uncertain results, just because there's variants or variations in their DNA from the norm, but we don't have enough evidence about that variation at the time to classify it. And that can be frustrating to the patient if we don't have specific results that we can give them at the time. So that's something that we discuss within the session. Another thing we do is collect the sample. This can be done by either blood or saliva. Results usually come back within 21 days or so. And then we review the results with the patient and provide the necessary follow-up depending on the results. So insurance coverage for genetic testing has gotten much better over time. There are national criteria predetermined for insurance companies to follow as to who should have genetic testing and who doesn't necessarily need it. Some insurance companies loosely follow this criteria. Some more strictly follow it. So depending on a person's family history determines what their coverage for the testing will be. The national criteria changes every year as we get more information about genetic testing, more information about cancer. Insurance companies, one frustrating thing is they're typically a year behind current guidelines. So sometimes the guidelines change, but the insurance companies haven't changed their guidelines for what they will cover. If you do not meet criteria, then your testing will likely not be covered by the insurance, but labs are very big on making genetic testing widely available and accessible. So they do offer out-of-pocket cash pay prices for patients. And that's about $250 for most laboratories. There are also many patient assistance programs that laboratories have that can cover people who are under or uninsured so that they can still have the testing even if their insurance isn't covering it. And then some labs offer complementary testing to relatives if a patient tests positive. So there's many times that if a parent tests positive for a genetic mutation, their children are able to get the testing at no cost. And some frequently asked questions that we get during genetic counseling sessions is, will my insurance cover genetic counseling and genetic testing? Most of the time, insurance companies do cover genetic testing if the patient meets testing guidelines. I've heard genetic testing is so expensive. I couldn't afford it if my insurance doesn't cover the cost. Not anymore. Like I said, back in the early 2000s, genetic testing was about $2,000 to $5,000. Now we can offer patients genetic testing for as much as $250. Like I said, many patient assistance programs can bring the cost down even lower. This is a really, really big question. I've already had cancer. What else can genetic testing tell me? A lot of physicians and a lot of patients feel like a patient doesn't need genetic testing if they've already had cancer because it's not going to change the fact that they had cancer. But it doesn't matter. Everyone needs genetic testing, no matter if they've had cancer or if they haven't. And that's because genetic mutations can confer more than one cancer risk. Just because you already had cancer doesn't mean you don't have a risk of having another cancer in the future. And then also it's really important to do the testing for your family members because they could also be at risk to develop these cancers if they have a genetic mutation. And then genetic testing, even in a person who has cancer, can alter their surgical decisions or their treatment options. And then another big question is, will my insurance company or employer use my genetic information against me? This is where this Genetic Information Non-Discriminatory Act comes into play. This is a federal law put in place in 2008 that protects an individual against health insurance discrimination. So your health insurance cannot charge you more money or drop you from the policy if you have a genetic mutation, and your employer cannot fire you because you have a genetic mutation. The thing that it does not protect against discrimination from is life insurance, disability insurance, and long-term care insurance. And that's just because these insurance policies use your family history and your personal history to determine coverage and cost of coverage. If you already have these things in place before you pursue genetic testing, it does not affect the policy. But if you have genetic testing before getting these policies, they are allowed to ask you about your genetic status. So in summary, you can't change your genes because these are things that you were born with, but you can change the outcomes if you know about them. And this is why genetic testing for hereditary cancer is a very empowering thing to pursue, because it can really prevent cancer and save lives. So now I'll take questions. Here's my email address. Feel free to email me anytime if you have any questions. And then at UT Southwestern here in Dallas, we do accept self-referrals. So if this presentation resonated with you, or if you know if your family would be a good candidate for genetic counseling and genetic testing, or you know anybody who could benefit from this, you can have them call this phone number, and we'll set up a time for you to meet with us.